Get to the latest at Pine Rest and their new pediatric center. Joining me this morning is Dr. Heidi Rollins, who's the medical director there at Pine Rest. Let's first talk about the pediatric center. If this is the first time somebody is, hearing about this,
Yeah.
what is it and what can we expect?
Absolutely. Well, we're building a facility that will bring in the majority of our children and adolescent services on our main campus.
Okay.
And it'll have inpatient care, partial day program care, urgent care where we're walking in for crisis, as well as some outpatient specialty care and testing services. So a whole range of services.
Lots of things going on there.
Yes.
So I know construction started last year. You had a
Correct.
groundbreaking, what was it, in February or May?
It was in May, yes.
But you are expecting it to be done by next February. So how is construction coming along? We're taking a look at a time lapse and you can really see a lot of the progress that they've made.
Absolutely. Oh, it's really exciting on our campus. It looks like it's moved really quickly and it's been amazing to see. We get to go in from time to time and see the different programs. It'll be open March 2026.
Okay, March 2026,
Yes.
There you go. All right, so you mentioned about some of the care options that you guys have at this new facility. Can you mention some of the ones that you guys are focused on here, and how is that going to help you bridge the gap in terms of treatment where you guys aren't necessarily, helping people with right now?
Yeah, absolutely. Well, some of the programming that we're developing in advance of opening the centers to really meet the community need now. So we have eating disorder partial day programs. So kids come in during the day, nutrition and multidisciplinary therapies are part of their treatment, and then they get to go home at night and practice their skills. So we opened that in October in our current space and can't wait to move that into our new space and expand. We also have some programming specifically for kids and teens with autism spectrum disorder and intellectual disability that will help meet their needs a little better too.
Very cool. So it sounds like you guys really are thinking of everything when it comes to this new pediatric center in terms of the care you're able to provide. Can you talk about the urgent care a little more? What does that look like? What will that look like when folks come into the new pediatric center?
Yeah, absolutely. Well, today we serve adults in urgent care, and we'll have our center specifically focus, of course, on kids, but it'll have a separate entrance. We heard families in crisis really want to be able to get right to assessment, so we'll have someone greet them right away, triage, get a sense of what they need, and they'll be able to be assessed right away and have a mental health assessment and placement for whatever programming and level of care that they need.
So it's really kind of immediate. You diagnose the situation and then immediately get them into the programs that they can be in to kind of remedy that.
Absolutely.
Can you talk about your patients as a whole? What are you guys seeing across the board in the pediatric realm? Where's the greatest need at right now?
Yeah, well, I'd say it's a broad range of needs. We see kids that need inpatient level of care because they have depression, anxiety, or suicidal thinking. We see kids that benefit from our day program where they're struggling to attend school and have, a variety of different mental health struggles such as anxiety and depression in those settings as well. As I mentioned, eating disorders is certainly on the rise, so we're being thoughtful about how to address those needs. In outpatient treatment, we see sometimes wait times for specialty level of care, so that all went into our planning for our programs.
Okay, yeah, so very interesting, all to come in the next year when you guys open that back up in March.
Absolutely.
So again, we're about a year from the groundbreaking, happened in May of last year.
Yes.
What would you say are some of the things you guys are working on now to get into that building? Where's the process at?
Yeah, well, hiring. We are really looking for all disciplines. I'll be working nurses, psych techs, psychiatrists. Our medical team is expanding, so we're expanding just about every discipline who works with kids and actively looking to recruit and hire. We're also training our staff, particularly in those specialty level of cares that I talked about, making sure they have the right training and the right team dynamic to offer the best level of care they can do.
Okay, this new center, it's going to allow you to partner with hospitals with a greater capacity here locally in West Michigan. I'm assuming one of those is going to be the Children's Hospital downtown as well that you guys will be partnering heavily with.
Yes.
What sort of access or what sort of care does that open you guys up to be able to help folks when you open this new pediatric center?
Yeah, well, I think we're really working closely with Helen DeVest to ensure that kids have good, seamless transitions if they experience care at both of our organizations. So ensuring that those handoffs and transitions go well and that families experiencing them in a positive way.
And you were mentioning some of the things that you guys are noticing with children with today, some anxiety, depression issues,
Yes.
also eating disorders and things like that. Why do you think that we're seeing that more? Do you think it's just because we're talking about it more, or do you think that there's actually an issue making things worse for children to where they're experiencing anxiety and depression on a level that we haven't seen before?
Yeah, I think both are honestly true. I think the more that we're aware, the more destigmatized it is to come forward and talk about mental health struggles, the more likely youth are to get the help that they need and to get care. I also do think there have been a lot of pressures on our youth in the last, 5 years, even with COVID and social isolation. Some look at social media and wonder if that's playing a role. So there certainly are unique impacts that kids have had to go through in the last few years, contributing to what they labeled as a mental health crisis really just a few years ago.
Yeah, it's really interesting to hear just kind of the struggles that happen with children today, especially going through something that they did with COVID. What do you think was like the contributing factor to making things how they are now, especially when it relates to COVID?
I think disrupting kids' routines. Kids and teens are very used to having their routines, both socially, how they experience school, how they experience family and outings, and those really got such severe disruption that I think on a lot of different levels that probably was the largest driver of some of those impacts, being removed from their normal social connections, not having those routines in their life, having uncertainty and ambiguity about their loved ones and what their school and next days might look like. I think we're big pieces of that.
Absolutely. So again, the pediatric center that you guys are building right now, it opens next year in March.
Yes.
But you guys still do offer pediatric services now.
Oh, absolutely.
So what are some of the things that you guys are still offering in the interim until you guys get into that pediatric space?
Yeah, well, Pine Rest already has such a wide range of services now. So if you need that help, you can call in and get services today. We have testing, psychological testing to help clarify diagnosis. We have inpatient care, day program level care, a host of outpatient services as well throughout many of our different locations.
All right, so still a wide range of services before you even get into that new pediatric center. We were talking before we got on here that we wanted to mention a substance use program that you guys are running. This is basically to teach parents how to have those age-appropriate conversations with kids and how to navigate the substance abuse with kids in today's age. That's this Thursday. There are 2 sessions there. It's at Pine Rest there. And so if you want to have more information on that, you can go to Pine Rest's website there. I really appreciate you joining us this morning. Thank you so much, Heidi. Appreciate it.
Thanks for having me.
All right.